last couple of years, there's been a lot of discussion on how we need to fund our nonprofits and help out the work that they're doing out in the community. Frankly, we've talked a lot, of course, in public safety about mental health, and I keep saying that the city is not in the business of mental health, but there's a lot of agencies out there that are working this issue, boots on the ground, and that's really, I think, what we're talking about here today, not specific to mental health, but a lot of different issues. The one thing I think the pandemic, one of the things the pandemic has made clear is how invaluable these nonprofits are. I am sort of conflicted. Councilwoman Castillo talked about last week in public safety. We discussed the importance of aiding our foster youth and specifically housing youth that are at risk, our senior services, and I would like to keep in line with that as much as we can. And the other ARPA dollars that were and other committees that were expended just to increase the impact of the dollars that we're able to allocate recently. But the other side of me is, there's a lot of nonprofits that we've been funding for many, 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 many years. And I know we have a partnership with places like Haven for Hope, so there are exceptions to it. But I just wonder if there's ever any, like, off-ramp, like helping them to become self-sustaining. So I'm conflicted. I mean, I know that they're doing good work out there, but there are some that I think maybe could be a little bit more self-sufficient. And I'm not going to name any out. I just think that there's a number of them. However, I think the metrics that you're talking about, or the dashboard you're talking about, I'm really interested to see that. I think that would help me kind of reason through that. And then talking about the specific items that we talked about at public safety was, I mentioned the foster youth, at-risk youth was another one, senior services, and the harm reduction. That's all something I'm very interested in pursuing for this. Are any funds designated specifically? I think it was slide 5, you had the strengthening families and ending homelessness. Are there any allocated funds for foster youth housing, either there or anywhere else, really?
So the $4.6 million under homeless competitive funding includes a state grant that funds homeless services for youth, housing, outreach, those types of activities.
So it's not specific to foster youth aging out of the system?
It's not.
Okay, but it doesn't exclude them?
But
I mean, obviously,
that's something that as we're writing the scope of work and, we're learning from the ARPA process as well, we will definitely call out that population.
Okay. And the senior independence, I think it's the same slide. We have in the budget, y'all funded programming at Darner. We have Darner, the facility out there, and long term, I'd like to see a senior center out there in Edgewood. But right now, that has been very successful. We have they're so excited, and they go out there all the time. And the reason for that is it's in their neighborhood. They're able to get there very easily on their own without waiting for a ride, anything like that. So, is there anything? What exactly is the center-based activities and programming? Is it similar to what's going on at Darner?
It would include Darner. So
okay.
We have our 11 now comprehensive senior centers, and it's everything from fitness, Zumba, arts and crafts, computer education. So we would do the same thing at Darner and provide those services. As we're opening new centers now, money is programmed into the budget for those activities. So we don't have to stretch the same amount of money from 10 to 11 to then 12.
Okay. I mean, I mentioned Darner as an example, but of course, I mean, citywide, we're talking with the amount of money we're talking about. The other question I had, or maybe just more of a comment, is I think it was slide 6, the $2.6 million allocated towards housing opportunities for persons with AIDS. I'd like to see a breakdown of what those opportunities look like and what supportive services are incorporated. I'm interested in, and I support that absolutely.
Sure.
Just interested to learn a little more about that.
We'll get that too. It's primarily housing, food, transportation, and some medical services.
Okay, thank you. And finally, the chart on slide 7, the prioritization areas of highest need. There's a note that they'll be based on a data-driven approach. What is the process for data collection? How are we receiving that data? Is it coming from nonprofits themselves? How often are they giving us that data?
Well, the center of it, we have a social demographer now that puts together excellent information
Okay.
on, so every category, she's going through and looking at what are the relative indicators and data points to help agencies craft their proposal based on that data, but also to help drive the demand for programming or changes,
Okay.
identify where the gaps are.
Okay,
So that's our primary support, but we also use data provided by Up Partnership, by the Sarah Homeless Coalition, anything we can get our hands on.
awesome. I really, I got to give you props for the demographer. I think my first council meeting or my first couple, I asked about a demographer, and now I see in your explanation how useful that's going to be on a lot of fronts. So thank you. Thank you, Mayor.